Hi, friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम DSSSB नर्सिंग ऑफिसर एग्जाम द 28 ऑफ अगस्त 2019 शिफ्ट सेकंड का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर पिछले वीडियोस नहीं देखा है तो प्लेलिस्ट में जाकर देख सकते हैं और वीडियोस के डिस्क्रिप्शन में भी लिंक प्रोवाइड करवा दूंगा। अगर व्हाट्सएप में वीडियोस का लिंक चाहिए तो पर्सनली व्हाट्सएप मी, माय व्हाट्सएप नंबर इन डिस्क्रिप्शन बॉक्स। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। 26. Which term refers to the progressive increase in skill and capacity to function? A. Intelligence. B. Development. C. Growth. D. Maturation. Correct answer B. Development. 27. The brown adipose tissue, BAT, is not located in which of the following areas? A. Interscapular region. B. Sacral region. C. Supraclavicular region. D. Axillary region. Correct answer B. Sacral region. 28. Which enzyme is secreted by a sperm which helps in its penetration into the ovum? A. Glucocerebrosidase. B. Protease. C. Amylase. D. Hyaluronidase. Correct answer D. Hyaluronidase. 29. Mr. X is on a diet for obesity. He wants some of his favorite dessert, ice cream, but he is also reminded of his extra calories. Identify the type of conflict. A. Approach conflict. B. Double approach avoidance conflict. C. Avoidance conflict. D. Approach avoidance conflict. Correct answer D. Approach avoidance conflict. 30. Which drug causes lactation suppression in a postnatal mother? A. Metoclopramide. B. Oxytocin. C. Bromocriptine. D. Sulpiride. Correct answer C. Bromocriptine. 31. Which of the following is noted on the external monitor tracing a contraction when a nurse suspects umbilical cord compression while monitoring a mother in labor? A. Early decelerations. B. Accelerations. C. Variable decelerations. D. Variability. Correct answer C. Variable decelerations. 32. All men are mortal. Socrates as a man. Socrates as mortal. Identify the type of reasoning. A. Dialectical reasoning. B. Deductive reasoning. C. Democratic reasoning. D. Inductive reasoning. Correct answer B. Deductive reasoning. 33. Which instrument is used for low rupture of membranes? A. Koch's forceps. B. Ovum forceps. C. Kylelin's forceps. D. Carrette. Correct answer A. Coach's forceps. 34. For which of the following vaginal signs, increased pulsation is felt through the lateral fornices during pregnancy? A. Higg's sign. B. Jacquemin's sign. C. Chadwick's sign. D. Ozinda's sign. Correct answer D. Ozinda's sign. 35. Which procedure is performed in order to prevent an abortion in case of cervical incompetence? A. Metroplasty. B. Induction. C. Cyclage. D. Colpotomy. Correct answer C. Cyclage. 36. What is the condition called where the uterus is turned inside out partially or completely? A. Retroversion. B. Inversion. C. Involution. D. Subinvolution. Correct answer B. Inversion. 37. Which of the following movements occur after delivery of the head during the mechanism of labor? A. Crowning. B. Internal rotation. C. Flexion. D. Restitution. Correct answer D. Restitution. 38. Which nursing intervention would be appropriate initially, when a nurse assessing the uterine fundus of a mother in the immediate postpartum period notes that the uterus feels soft and boggy? A. Push on the uterus to assist in expressing clots. B. Elevate the patient's legs. C. Massage the fundus until it is firm. D. Encourage the patient to void. Correct answer C. Massage the fundus until it is firm. 39. In which position is a pregnant lady to be placed on the delivery room table for a cesarean section? A. Supine position with a wedge under the right hip. B. Prone position with the legs separated and elevated. C. Trendelenburg position with the legs in stirrups. D. Semi-Fowler's position with a pillow under the knees. Correct answer A. Supine position with a wedge under the right hip. 40. Which of the following signs or symptoms would a nurse note if superficial venous thrombosis were present in a mother who delivered a healthy infant by cesarean section? A. Enlarged and hardened veins. B. Coolness of the calf area. C. Palpable dorsalis pedis pulse. D. Paleness of the calf area. Correct answer A. Enlarged and hardened veins. 41. The urine examination of a child with acute glomerulonephritis shows: A. Decreased specific gravity. B. Increased urine output. C. Brown color urine. D. Red color urine. Correct answer C. Brown color urine. 42. Which site is the most preferred in order to administer DPT vaccine to an infant below 1 year of age? A. Deltoid muscle. B. Biceps muscle. C. Vastus lateralis muscle. D. Gluteal muscle. Correct answer C. Vastus lateralis muscle. 43. Which condition presents lockjaw as the initial clinical feature? A. Tetanus. B. Tuberculosis. C. Pertussis. D. Rabies. Correct answer A. Tetanus. 44. A physician advised a viral load test for a patient with HIV. What is the purpose of this test? A. Identifies antibodies against HIV. B. Measures plasma HIV RNA levels. C. Helps in confirming seropositivity. D. Detects antibodies for HIV. Correct answer B. Measures plasma HIV RNA levels. 45. Identify the type of hypersensitivity related to cell-mediated hypersensitivity. A. Type 1. B. Type 2. C. Type 4. D. Type 3. Correct answer C. Type 4. 46. Which clinical staging of Wilms tumor involves metastasis to distant organs? A. Stage 3. B. Stage 4. C. Stage 2. D. Stage 5. Correct answer B. Stage 4. 47. Which laboratory study would confirm the diagnosis of rheumatic fever? A. Platelet estimation. B. Hemoglobin estimation. C. Red blood cell count. D. Antistreptolysin O titer. Correct answer D. Antistreptolysin O titer. 48. Which of the following options is also known as Bell's palsy? A. Facial palsy. B. Klumpke's palsy. C. Brachial palsy. D. Erb's palsy. Correct answer A. Facial palsy. 49. What does acid-fast staining do? A. Differentiates between acid-fast bacteria, red, and non-acid-fast bacteria, blue. B. Cannot differentiate between non-acid-fast bacteria, red, and acid-fast bacteria, blue. C. Differentiates between non-acid-fast bacteria, red, and acid-fast bacteria, blue. D. Cannot differentiate between acid-fast bacteria, red, and non-acid-fast bacteria, blue. Correct answer A. Differentiates between acid-fast bacteria, red, and non-acid-fast bacteria. 50. What is the ideal position during a lumbar puncture? A. Lateral recumbent position with knees flexed. B. Supine position. C. Lateral position with extra pillows under the head. D. Fowler's position. Correct answer A. Lateral recumbent position with knees flexed. कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। And don't forget to subscribe. Thanks for watching. See you in next videos.